I'm Tammie Collins, and I'm the new Executive Director here at the Anderson Free Clinic.
And Tammie, what made you want to come over to the Free Clinic? Because you were already working here at Anderson with a nonprofit.
Right. I love the idea of serving those in our community. There's a huge need for healthcare services here in the community. My daughter rotated through here as a volunteer physician and had a wonderful experience. And being able to serve locally brings me great joy.
Why is the Free Clinic such an important part of the Anderson community?
Well, first of all, when we're all healthier, when our community is healthier, we all benefit from that. When we're not healthy, it costs us all. And so it's like that old, all the ships in the harbor rise. So if we can help those in need of health care that they can't get otherwise, we all benefit from that. The Anderson Free Clinic provides medical services for those in the gap that don't have some kind of government assistance or private insurance. And there's a lot of folks in our community. So they provide health care, pharmacy, dental is one of those areas that we're working on right now. And what I think is very critical that the Anderson Free Clinic provides is a continuum of care. This isn't an emergency stopgap, but we work closely with our folks at ANMED and providing that continuum of care for folks, a resource for them to have continued coverage, regular medical appointments, and not just an emergency stopgap. We've got a full pharmacy for folks, a huge need for diabetic supplies. It's a huge expense for folks. With that, it can run into hundreds and hundreds of dollars every month. My husband's diabetic, so we know what it means to have insurance for that. If you don't have insurance, to be able to come here and get those supplies on a regular basis, and again, not have to look for emergency fill-ins, but to keep that supply available for folks. Volunteers are here because they have the heart and the passion for it, and anything we can do to encourage more folks to come in and volunteer. When you see hands-on what some of our folks are facing in our community, the Anderson Free Clinic really has become such a meaningful way of serving our community for so many folks, and we truly appreciate that, and we couldn't do it without the volunteers. Our physicians in the area are so busy, especially now with the new electronic system. Epic has been epic for most of our physicians in their offices. So for them to be able to carve out some time and meet these patients and work with them in a caring way is immeasurable is what that is, and we couldn't do it without them. I would love to see this a place that not only serves people here, but we look at ways to serve more in our community, things that we can provide outside the walls and the hours of the clinic. And we'll do that as we continue to build our volunteer base, as we continue to build resources. And I look for that to be the next arm of the Anderson Free Clinic, is to be in our community beyond these walls and beyond these hours. The clinic is open for patients Tuesday, Wednesday, and Thursday, and it varies day to day. And so if we can provide maybe a weekend, half-day clinic from time to time, or some evening hours for folks that are working, especially hourly. So many of our people are working, but if they're not at work, they're not paid. And so to have some opportunity for them to come in the evening or on a weekend would be an excellent opportunity for us to fill. The financial need is obvious. It's always here. To run a clinic of this size, it takes a lot of dollars. And so there's always a financial need. We're always fundraising. We're always writing grants and looking for opportunities. So anytime we can find a partner to consider supporting the Anderson Free Clinic financially is wonderful. It's so important, the partnerships we have here in the community for donations, partners like Golden Harvest Food Bank, Walgreens Distribution Center. Partners like that are critical to our success. And our volunteers, they're the best. absolutely the best. They have a passion for this work. It's a calling. It's not just I'm going to give back a little to my community, but it's a calling. And what I'd love to see is more of our retiring physicians and nurses maybe consider supporting us with a few hours a week. We'd love to have them. That way they can still keep their hands in medicine but give back to their community at the same time. I've been here a little over 5 years. Had been at Columbia College, directing leadership programs at Columbia College before moving up here. My husband was working in Greenville, so commuting back and forth to Columbia got a little old, and we naturally fell in love with the upstate, as most folks do. So I began searching up here, and the United Way position came open. Carol Burdett and I had a clandestine meeting in Greenwood, and from there it was an automatic connection. And so I've been at the United Way here in Anderson County since then, and I worked first in our education area helping develop education programs, and then moved over to our volunteer center. And my biggest responsibility was coordinating the Weekend Snack Pack program, which is a program in Anderson County that feeds almost 1,000 children every Friday throughout the school year. Children that are going home to little or nothing to eat on the weekend, and that impacts how they come back to school on Monday. They're not ready to learn at their capacities. So it's a program that I've been very passionate about because, again, it's local. It's people right here. It's families in our community that we see every day. And that's the same thing with the free clinic. That's why it was a natural move to the free clinic. These are people we see every day here in our communities. Because of my United Way work, my network has grown exponentially in the time that we've been here. Wonderful people, wonderful connections, and so it's just a matter of building on those and finding more folks that are passionate, that have a passion for those in the medical community, and so it's a natural transition.